To most people, they are a cosmetic issue, but in reality, varicose veins are a visual symbol of a deeper health issue. Venous insufficiency, more commonly referred to as vein disease, is a condition that affects more than 80 million Americans each year. Normally, calf muscles squeeze blood in the leg veins back to the heart after taking a step, properly circulating the blood upward. But in some people, poor circulation disrupts this movement, causing blood to reflux or pool in leg veins. If left untreated, it's a condition that can lead to more serious symptoms and vein disorders.
Patients often come in with a cluster of veins that are bulging that they see, often in the calf. The problem that led to that cluster of veins is often in their thigh, where they have a valve that has failed in the greater saphenous vein. And so it's a lot like having a wet spot on the wall that you do see due to a broken pipe in the ceiling that you don't see. And so until you fix the broken plumbing, it's not going to do any good to deal with the wet spot on the wall because it'll keep coming back. If those symptoms remain untreated, complications begin to ensue. Thrombophlebitis is probably the most common, where the veins clot, often after a long trip traveling. Sometimes people come in having bled from the varicose veins, and other people go on to get brown patches of skin, usually around their ankle, that eventually develop a sore centrally that won't heal, called a venostasis ulcer.
While the use of graduated compression socks help alleviate the symptoms, they don't eliminate the problem, nor do they prevent the progression of vein disease. Certain outpatient procedures have become popular in recent years because of their success rate and simplicity. At his practice, Dr. Haney treats vein disease patients every day and is proficient in a technique called the venous closure procedure, which has an incredibly high success rate. A treated vein has a 98% chance of being closed forever.
The venous closure procedure is a very simple procedure whereby we use heat to close the affected vein that has the valvular dysfunction. So we put a radiofrequency catheter, it's about the size of a spaghetti noodle, and you put it in the vein through a needle puncture, slide it in the vein all the way up to the groin, and after a series of injections to numb up the vein, you turn the heat on and it ablates small segments of the vein at a time. So you'll do a segment and you pull it back, do a segment, pull it back, do a segment and pull it back. The procedure often takes 15-20 minutes to perform. After we're finished with the procedure, they go into a support stocking over which we put an elastic wrap on their leg, and then we put them on the treadmill and let them walk for about 20 minutes. They're usually in the office about an hour altogether, including the walking time.
My symptoms were generally like leg pain and throbbing, discomfort, and it just kept getting worse and worse and worse. So I decided to have that procedure done. It was fairly quick and I felt a lot better almost immediately after.
Some of the symptoms that I had with my leg were pain down the back of my leg, and the thing that really bothered me was waking up in the middle of the night with leg cramps, where I would have to get up and walk them out. After the procedure, the day after, the leg cramps stopped. I had no more leg cramps, no more leg pain. It was completely gone. I had no problems going back into any of my daily activities at all. And today I feel great, 100%. It's incredible.
Medical procedures to treat vein disease continue to improve and evolve. As they do, many doctors remain on the cutting edge, ensuring their patients' health every step of the way.
Our mission is to provide the most up-to-date modern vein care that is least invasive, the most safe for the patient, and gets them back to their active lifestyle quickly. We want to heal their complications if they have ulcers or clots or bleeding, and stop those complications from occurring and get them back on their feet and back to what they enjoy doing.
Located in Bentonville, Arkansas, Dr. Haney and his staff provide the safest and most effective treatment options to people with varicose veins and more serious symptoms of vein disease. Diagnosis and treatment are fast, simple, and virtually painless, getting you back on your feet in no time.
A very thorough ultrasound is performed to diagnose vein disease. With color flow imaging and Doppler, we can determine which direction the blood is going. If a vein has backwards flow, then you're better off without the vein than to have it go in the wrong direction. And so if it's big and deep and straight, we'll often close it with heat. Often the venous closure is our product of choice. If the vein is crooked and superficial and right under the skin, then we have other options to treat that.
Dr. Haney is a fantastic surgeon. He does a great job with all of our patients. In addition to being just a really nice and friendly guy, our patients really enjoy coming to see him. He gets great results. We've never had any patient come back and say that they weren't pleased with the results that they got from him.
Dr. Haney and his staff are just wonderful. They're very, very professional. He knows exactly what he's doing. He was very good with the procedure itself, but has great bedside manners. And today I feel great. My symptoms are gone. My legs look better. They feel better. And I'm able to play soccer again. So.
He explains everything in the procedure. He makes you feel extremely comfortable. The procedure itself was pain-free, and they just really treated you like family here.
If you or someone you know suspect you might have vein disease, schedule an appointment with Dr. Haney today.